Hi, this is Brandon with ChiroUp, and today we're going to cover an article that just came out this month. And it's in Journal of Back and Musculoskeletal Rehabilitation, and it reaffirms those things that we talk about in our seminars. It reaffirms what I see in my practice, and it's a huge source of frustration that I have seen, is that when you have somebody with one problem and you fix that problem, you do it quickly, you do it effectively, you explain all the little caveats to that problem, and then the patient comes in with something else. And often I feel like a failure when that happens, because when somebody comes in with one issue and then it's the next side or it's something down the chain or up the kinetic chain, I think to myself, oh, I should have noticed that. And that if I just would have assessed the whole body and I would have taken a more systemic approach at it, I would have had much better results with that patient, not only in getting them out of pain, but hopefully keeping them out of pain. This journal article hit home with me is because they looked at two points that I'm well versed in, as far as patients who have any kind of patellofemoral pain. They often have weakness in hip abductors and they have decreased core extensor strength. Now that's well documented. You look at all the journal articles and I thought, well, duh. But they did also find these were female athletes with patellofemoral pain syndrome, is they also had decreases in plantar flexor strength. And often I find with a lot of my runners, a lot of my volleyball players, my soccer players, is they come in with that plantar fasciitis and Achilles tendonitis. They come with medial tibial stress syndrome. They come with those lower leg complaints. And I can relate that to all hip abductor weakness. I can relate it to any other problems. But when you start to see that kind of weakness be present with a localized problem, that tells me I need to address the whole chain. That it doesn't matter if they first came in with a plantar fasciitis. It doesn't matter if they came in with back pain. It doesn't matter if they came in with that patellofemoral pain syndrome. I need to be addressing the entire kinetic chain. Now, I don't do the whole body. Unfortunately, we just don't have time to do that. But as far as a lower or upper extremity complaint, we need to be taking a more global approach to it. So the way I think about it in my head is treating the entire chain, not the specific link they come in with. So, for example, for this patient with a patellofemoral problem, do a single leg stance test. If they do a single leg stance test or a 6-inch step down test, and they can pass that and they're perfectly fine when they get out of your care, great. Your knee pain's gone, go out, go play your sport. However, if their knee pain is gone and they still can't pass your functional exam properly, then attack that with your at-home rehab. Check out the new protocols as far as hip abductor weakness that will address those problems. But you're really setting those patients up for future problems if they get out of your care with their knee feeling pretty good, but they still have that original problem, that they're probably going to come into your office again. So I hope you can take this information, check out the protocol at ChiroUp, and if you have any questions, shoot me an email, Brandon@ChiroUp, and I'd be more than happy to answer any questions for you. Thanks.